how sound gets into your brain or into your skull. Right here is the mastoid process. Right here is the styloid process. So we have a mastoid process and we have a styloid process. And just between them here is the stylomastoid foramen. You know, that's for the seventh cranial nerve. That's how that seventh cranial nerve, the facial nerve, comes out. So for the temporal bone, there's a squamous portion, or squamous, I don't really care. This is the zygomatic process of the temporal bone. This is the mastoid process. This is the styloid process. This is the external auditory meatus. Between these two is the stylomastoid foramen. Stylomastoid foramen. Okay, inside, the eighth cranial nerve takes the sense of sound into your brain. That goes in by way of this hole here. That's the internal auditory meatus. So there's the external auditory meatus and there's the internal auditory meatus. Okay, going from this point, and I'm really not going to use the exploded skull. I might do that a little bit later. There's other parts that you should know. We've gone here into the frontal. This flat part of the frontal is the glabella. Right here is the supraorbital foramen. If it's broken, it's called a notch. You can call it either one. I really don't care. You know, all of this is frontal here, and again, I indicated frontal there. Now, getting into some of the facial bones, if I hold the skull right here, I hold the skull like that, I'm holding the ethmoid bone. So that's where the ethmoid bone is. And there are conchae on the ethmoid bone. There's a superior in the middle, but I am not going to ask those on the exam. So I'm not going to ask the conchae of the ethmoid bone. I know they're on your sheet. I wanted you to look for them, but I knew from the beginning I wouldn't ask them. But another part of the ethmoid bone is the superior portion of the nasal septum. Superior portion of the nasal septum is called the perpendicular plate. So I can get a piece of tape on that, and if I do and ask you what it is, it's the perpendicular plate. We can also see the ethmoid here. This little plate I have the stick on is the cribriform plate. And the little thing that sticks up is the crista galli. It's basically something that's going into the two different hemispheres of the cerebrum. So this right here is ethmoid, should know the crista galli, the cribriform plate, should know the perpendicular plate. Those are the main things to pay attention to. Okay, going down from there, we have a couple of bones that are small. The inside of the lacrimal canal is the lacrimal bone, very, very, very tiny bone. We have an inferior nasal concha, which I will possibly ask. I'm not going to do the conchae off of the ethmoid, but this inferior nasal concha is a separate bone, and you should be able to identify that. We also have the vomer. The vomer makes the inferior portion of the nasal septum. The superior portion is the perpendicular plate. The inferior portion is the vomer. Okay, here and here we have the maxillary bones. These things are the maxillary bones. You can call them the maxillae. This is the infraorbital foramen. You know, it's below the orbit, the infraorbital foramen. As you look at the maxilla, right here, there's a part that articulates with the zygomatic. That's the zygomatic process. Right here, there's a portion that articulates with the frontal. That, in fact, is the frontal process. If I were to look at this bone, it would be hollow. There's a couple of skulls that I can show this on. That would be the maxillary sinus. And right here, we have the alveolar border, or the alveolar margin. An alveolus is a socket, and these are the sockets that your teeth fit into. So we call this whole border here the alveolar border. Okay, let's get to the more difficult one back here. First of all, let me point out that there are some foramina that are visible from this side. I showed you some before. Actually, I showed you one, the stylomastoid. Stylomastoid. If I want to ask it, I'm going to have to put the skull down like this and stick something in there. But notice on the temporal bone, there's also this one. This is the carotid canal. That's for the internal carotid artery. Let me move my hand. It's right there. The carotid canal. It's for the internal carotid artery. That's part of the temporal bone. That's part of the temporal. And behind it, back here, is the jugular. The jugular, that's between the temporal and the occipital. The jugular is between the temporal and the occipital. So from this side, this is what I could ask. I could ask condylar, hypoglossal, foramen magnum, carotid, jugular, and stylomastoid. The foramina on the sphenoid bone, I'm going to ask only from this side. It's the only side that you'll have to know them from. With the sphenoid, we have the lesser wings. Lesser wings. They're right in here. These are the lesser wings. We have the greater wings. Greater wings are right here. Okay. We have the sella turcica. You do need to know the sella turcica. It's right here. Underneath, we have the pterygoid processes. That's where they are. They're underneath. The pterygoid processes are down in this region here. If I want to ask the foramina of the sphenoid bone, I will ask them from this side, as I just said. This is spinosum, the little tiny one. That's spinosum. The one that's shaped oval is ovale. We're going to put nerves in these things. The one that looks like a tunnel is here, is rotundum. That's what rotundum means, tunnel. The one that is here is the optic canal. And the one that is here is the superior orbital fissure. Okay, just going down kind of quickly. This is all mandible in here. This is the condylar process, or the mandibular condyle. This is the cornoid process. This is the mandibular notch. This is the ramus here. This is the mentalis, or the chin. This is the mental foramen. One thing I often ask off of the skull is right where the condylar process goes into the temporal bone. It's called the temporal mandibular joint. It's right here, and that is the temporal fossa. Now, is my guys up here to have you see everything? No. My guys is to have you hear everything. The best way to memorize these is to write them, to say them, to hear them from a bunch of different people, to hear them from the teacher. I mean, these are words that you have to start putting into your vocabulary if you're going to do well, and I'm expecting a lot of people to do well on this exam. All the bones, all the parts. If there's something I missed that somebody wants me to go over, or anything you want me to go over that I went too fast on? Yeah. Yeah, this is a good question. I'm not going to ask it. And the reason I'm not going to ask it is because it should be right there, but it's not there. Most of the skulls don't have it drilled out. And so your textbook is identifying this thing as foramen lacerum. Well, it's not. Lacerum is called lacerum because it's like a laceration, like a long cut. This is the opening of the carotid canal, so that's a mistake in the textbook. So I'm not going to ask lacerum. One other thing I will ask are the ear ossicles. There's a little petri dish, and it has the incus, the malleus, and the stapes in it. I don't ever remember giving an exam where I didn't ask one of those. So, keep that in mind. Also, if you're wondering, what's he going to ask, everything I've mentioned has been asked on exams. Not everything's going to be on this particular exam because there'll be 50 stations, one question at each station. Each question is worth 2 points. Don't ask me if spelling counts, please. Okay, are there any questions other than does spelling count? Yes?
About the teeth, do we supposed to know?
You don't need to know the different types. I'm going to cover that when we get to the digestive system.
What's the question?
do we need to know incisors, canines, premolars, that kind of thing? And no, you don't for this exam.
Can you show the point of view for the pterygoid process again?
Yeah, if I want to do pterygoid process, I'll take the skull, I'll put it right like that. There'll be a number here as to what number it is, and there'll be a piece of tape, and you'll have a paper, and the paper will say identify the process or identify the projection. And pretty much I'm going to do this on the exam. 25 questions will be identify the bone. It makes the exam a little bit easier. So 25 questions are going to be identify the bone. That's all the bones of the body. Then there's going to be like 6 or 7 identify the hole, a few that identify the depression, a few identify the projection, etc. There will be some questions on regions, like on the sternum, on the os coxa. But before we take the exam, I'm going to do this with all the bones. I'm going to come up, bring you up, and I'll do this. I'll have to do it again, maybe 2 more times. But you'll be able to come up and ask questions about it and hear me say things about the skeleton.
You will ask sinuses too?
The sinuses are possible. You know, the maxillary sinus I can ask, the frontal sinuses I can ask off of that one skull. As far as the ethmoidal and the sphenoidal sinuses, I don't have any way to ask those, to tell you the truth. Any questions?
Thank you.
Then go away.